The following program is a pre-recorded presentation of Community Affairs. Three Score, a series of programs dedicated to the activities and lifestyle of the mature with Virginia Gale.
Last week we met and we talked with people from Oak Forest Hospital, and today we want to continue our conversation with Dr. Dodda Rao, Chief of the Geriatrics Department for Oak Forest Hospital. And I've got to say this right off the top because we want to talk about this. You're unique. You're a specialist in geriatrics, and American medicine doesn't recognize this as a medical specialty.
Of course, to attain the status of a specialty in this country, as you know, a particular field should have the backing of both the professionals as well as the politicians. But in a culture which is youth-orientated or profit-motivated, the priority for the elderly or for their care, for that matter, does not get high priority. Therefore, there is no great backing in that regard. Thus, there has never been a specialty in this country. Unlike in England and Europe, where there has been a specialty of geriatrics as early as 1960, 1961. One can take board certification examinations like you do here, board certification in cardiology or neurology or board certification in internal medicine. You can do all these, and also board certification in geriatrics in Scotland and England. Just so it is true of nursing too. You can be certified in addition to being an RN, one can be a GN also, that is geriatric nursing. They indeed get special pay for taking special interest in the care of the elderly.
Is it going to come, though? There are so many older people all of the time in this world now. Will it come to America? Will there be a specialty in geriatrics?
There is no way anybody can stop it from coming because it is a necessity. With the increasing millions of the elderly, the care of this population is bound to get more organized, as it has started to happen for the past 10, 12 years. Mm-hmm. And maybe about the year 1969, when I came here from England, there was no geriatric training program. The first geriatric training program was at Baltimore City Hospital, St. Johns Hopkins, where we used to train 4 to 5 physicians per year. I was there up to 3 years, up to 72. And in 1972, I came to Chicago to start similar physician training program at Oak Forest Hospital, because this is one of the largest hospitals in the country.
So it was important for you to be here.
Sure. And
that means you can train more interns.
That's correct. I was able to train. I started with 4 to 6 physicians in the beginning, and now we have 16 physicians per year trained at Oak Forest Hospital. Only in the last 2-3 years, the VA system also started to train some physicians, about 2 physicians at each center. Like that, at 6 centers they have started, and they have increased it to a few more. But nationally, there is a growing trend during the past 4 or 5 years. At least 30 to 35 medical schools have got some token program in the care of the elderly.
But you say that's only a beginning, because you do look forward to people
Indeed.
Really caring about the health of older
Indeed.
people, and not just telling you you're getting old, and then sort of letting you by the wayside.
Sure, indeed. Geriatrics is a more complicated care than merely caring for the illness itself.
What is geriatrics? Explain it.
Yes, geriatrics, like pediatrics is the care of the children in all aspects of their well-being. So it is the care of the elderly. Geriatrics, geron means aged, iatrics means treatment of the aged. When you call it treatment of the aged, it is not merely the treatment of the ailments they have, in addition caring for their social, economic, as well as psychological well-being. It is not enough to treat the arthritis of a patient and send them home when they have several steps to negotiate when they go home. Unless you relocate them where they can satisfactorily live, merely treating arthritis, just the acute phase at the hospital and sending them home, will not do enough good.
Because you have to be involved in all of these outside things too.
Absolutely, you have to see the overall needs of this patient, whereas several other supports to these patients are no longer existing. And physical disabilities are creeping up with advancing age, and they cannot manage with the low incomes they have. They have several other needs in addition to mere illness imposition by the illness itself.
They often have multiple problems, don't they?
Indeed. indeed, they do tend to accumulate their problems.
And as a specialty, you identify this and you can get into this a little bit better.
And also the manner in which a particular illness presents in the elderly is very different than other age groups. For example, often they may have a heart attack without having any pain. They can have bronchopneumonia without having rise of temperature.
Now, that's not what would happen with a younger person,
No,
so you've got to be able to identify
them, yes. And also they would have mild dizzier attacks or mild attacks of loss of forgetfulness and so on. These are related to cerebral arteriosclerosis, and this has to be diagnosed in time in order to help these patients. And certain other problems, of course, the complication of certain of the conditions like diabetes, hypertension, arthritis, all these will tend to creep on more and more with advancing age. So is the incidence of cancer. They have to be vigilant about screening these patients for all such problems they come to.
You say there are different techniques too. For instance, you really have to be patient. You have to give time.
Yes. It is indeed, that's very true. In fact, caring for the elderly requires quite a lot of compassion as well as patience. You can't do things in a great hurry. And you also have to recognize not all the diseases or conditions they have can be cured. We all know only some conditions can be cured, such as some infection like bronchopneumonia or urinary tract infection or acute heart attack and so on. But many more people can control very well, such as you can control diabetes, you can control hypertension, you can control some of these impairments as they occur. But some more you can control the pain as well. In addition to cure and control, quite a number of them definitely you can comfort and care for them in a compassionate way, because there is no cures for some of these conditions. After all, people go through life with diabetes, with hypertension, with arteriosclerosis, with arthritis. There are no real cures for these illnesses. That's how these elderly people arrive at their age, having gone through these various phases of episodes of their illness.
So in having compassion for them, you educate them to an acceptance.
And also to train them to cope with what they have rather than to rely upon what they have lost. If suppose they have lost the use of one limb, they have to manage how best with the other with the additional supports that can be given.
No, I think we should make a salute to Oak Forest Hospital because, as you say, it's the largest hospital. No, how do you say that? It has the largest section on geriatrics.
Geriatrics in the country.
In the country.
Yes, and we train the maximum number of physicians in this country.
And you treat it like a specialty, so you really get after the problems that are there. If seniors would like to talk to you a little bit more about this or find out what you're doing at Oak Forest, it may help them. Do you have a phone number they can call? We did this last week. We'd like to do it again.
928-4200 is our number. And
that's the admissions office, and somebody is there to counsel you and to see about application.
Yes.
An individual can be admitted on his own.
On his own. Just the family can call the hospital.
Yes.
And they don't have to be admitted. They can be seen as outpatients as well. Because,
they can.
Yes, we have a growing outpatient specialty as well.
Let me give that number again. It's a starting point for the problems you may have.
928-4200.
928-2400.
Yes.
And our guest has been Dr. Dodda Rao, who is the Chief of Geriatrics for Oak Forest Hospital. And thank you much for being with us, and thank you for giving us another day. Thank you.
This has been 3 Score with Virginia Gale. This has been a presentation of WGN Community Affairs.